Thank you for joining us for this third event in a series of webinars on reimagining the post-COVID world. These webinars are organized by the Institute for the Future of Knowledge at UJ in partnership with the Library and Information Centre. We're very grateful to the Library and Information Centre for their fantastic support in what is a novel context for all of us. This is part of a larger project initiated by the Vice-Chancellor's Office that seeks to look past the current turmoil and ask what comes next. I want to say that this is an academic forum, meaning that freedom of expression is protected on condition that it is courteously expressed. Recently, an extremely senior academic, Professor Glenda Gray, expressed a view that the government's current policies were not based on science and was rebuked by the government in a most improper and perhaps even unconstitutional way. A number of academics in turn rebuked the government, and I want to use this platform to likewise condemn the response to Professor Gray's sharing of her opinion, which was moreover an expert opinion. I think a society in which people cannot air their views is one in which good decisions cannot be taken, as John Stuart Mill argued. Moreover, Professor Gray was exceptionally well qualified and well placed to express her view. And indeed, it's a view that I personally share and have expressed on a number of occasions, including in writing in a report we published a couple of weeks ago from the Institute for the Future of Knowledge. The evidence base for the government's approach to lockdown restrictions and to easing them is indeed lacking. Moreover, the government hasn't made data available for others to assess. So I want to emphasize that because today we are talking about somewhat related matters. Today's event is titled Data and Delusion after COVID-19. When we settled on this theme, we were interested in what we perceived as a paradox. On the one hand, it's commonly said that we can't make good predictions about COVID-19 because we don't have enough data. On the other hand, the scientific research machine is many times larger than it's ever been before when we faced other serious pandemics. For example, the Asian flu in the middle of the 20th century. Our ability to share and analyze data has increased astonishingly as well. So how then can we not have enough data? And how can we be apparently no better able to understand our current situation and predict its outcome than we were back then? Or is this a misconception, a case of science being a victim of the unrealistic expectations created by its own success? This webinar explores a range of issues relating to data and trust in science in the aftermath of COVID-19. What went wrong with the modeling approach to prediction, if indeed anything did go wrong? How should policy and scientific research interact? And how should policymakers make use of data? Can people without domain-specific knowledge use data to predict better than the experts in that domain? And if not, then can data analysts themselves make predictions merely by studying patterns in the data? Turning to the generation of data, how does the individual interest in privacy weigh against the public interest in private information, notably location, which could be very useful in the context of a pandemic? So I'm going to now turn to my senior panelist, Dr. Shakir Mohamed. Dr. Mohamed is a senior researcher at Google DeepMind, and he's based in London, but he's originally from South Africa. Let me start by asking you, you're an expert in the application of machine learning to global challenges, including to health challenges. And let me start by asking you something that I just alluded to, which is the puzzle that machine learning would seem to be at home with messy data sets and coming to conclusions much faster than humans would be able to. It's been said that it can do that in the context of drug discovery for identifying potentially effective molecules that might be effective antibiotics and so forth. Yet it wasn't prominent and hasn't been prominent in this context in predicting the spread or the course of this pandemic. Can you tell us what's going on there? Is there a misconception of the abilities of machine learning?
Just thank you to everyone, all of the organizers for having me. It's great to join you in this way and to contribute to these kind of conversations. And I think so much of what this question is also picking up on the comments you made in the introduction in general about how expertise is entering into decision-making processes, particularly around advanced technology. So I wanted to maybe just pick up on the question precisely around the role of machine learning. The machine learning and artificial intelligence is very much in the public eye these days. And when we think about advanced technologies like this, I think it's particularly useful to think of it like a coin. On one side of this coin, you have a very scientific or an engineering field that's trying to address very particular questions of the way data is being used, how we build models, how we communicate predictions, and these kind of questions which are academic, scientific, and help us build technical products. But on the other side of this coin, you have an equally important component, which is around the networks, the systems, the stakeholders that are interacting and supporting that field of machine learning and artificial intelligence. And I think on both sides of that coin, when you look at them, you will see kind of things which are not quite ready for machine learning to take that role. So for example, when we think of it as an engineering or scientific field, we need to ask questions of where data comes from. Many of our current methods are based on having large amounts of data, very large amounts of computation, has very particular kinds of models that work on particular kinds of data. We also need to be able to build, usually over a longer period of time, data sets and expertise and domain knowledge to deal with that. And those are, for the most part, not in place for what we have right now. And then on the other side, you also need to ask those questions of systems and networks. Do we have, for example, even our South African government, a way of sharing data? Are there ways that we are thinking at institutional levels about what it means to share data in safe and systematic ways? How is it that we integrate those kinds of decisions and predictions into decision-making processes that are being done at a political and governmental level? How it is that we communicate uncertainty? How it is that we get the public on board into all of that? So I think for both of those reasons, maybe the reason you don't see it, I hope, is because there's a very mature approach being taken by machine learning and artificial intelligence as a field. And I think that approach is one that recognizes very explicitly that we cannot be caught in a trap of technological solutionism, to use that kind of expression, especially in a period right now where we need to make decisions. There is a period of crisis. So we can't say that the best solution to this kind of problem requires the most complicated technology. We also want to recognize that there are complex social questions going on, and we cannot solve complex social problems through mathematical formalization alone. We cannot create solutions in one setting that maybe works here in London and expect it to be portable and work in the setting of South Africa, for example. And then also when you develop these kind of solutions, they have ripple effects, that they have externalities that we may not think about. We need to think about those. So maybe if I just make one final comment, what we're actually thinking about is the role of healthcare, of public health. And I think it's rightful for us to be very cautious about the role in which we're taking advanced technologies to impact questions of healthcare and public health. And especially for all of us who are watching this call, as African citizens in South Africa and across our whole continent, we have a very rich history of harms when technology has been used in medical scenarios against citizens. And so because of that, I think rightfully there is a reason for concern for us to be much more cautious, to be more considerate about what it is that we're actually doing. So I think for all of those reasons, we maybe haven't seen the role of machine learning. But of course, there are many other fields which are already doing this and are integrating, and they are the ones that we are now relying on to get us through this period of crisis.
Well, that's a very responsible sort of an attitude from a machine learning perspective, I think. I don't know to what extent it's been shared by other predictive disciplines. I mean, that's the interesting question, perhaps. Especially the bit about modeling the sort of the collateral impact of the effects of the intervention you're trying to implement. I mean, something that struck me is that Google Health, as I think it was then, tried to implement famously a method for predicting flu spread, and of course they stopped it. It was based on search terms, and people were searching flu symptoms, and that would predict better than the Centers for Disease Control in America, where it was spreading. And of course they stopped it, but for reasons of responsibility, it started to go a bit wrong for various reasons. So that would seem to bear out that suggestion that there's a sense of responsibility there. I guess, of course, the question is then where one might get the data that could produce such things. And I suppose part of what you're saying is that really is ultimately the question. It's not so much a technological one. It's a question of what we feed in as well.
I think there's just so much about what it is you feed in. Expertise and knowledge comes in so many different ways. You have data as one form of expertise, and whether we are tracking cases of number of tests per day, seroprevalence and immunological response. But we also have other forms of data which come from the domain experts. And I think, one of the things that's particularly interesting with the question that you're asking, in many other fields of epidemiology, virology, the notion of models there comes by creating simulations of systems. But usually in machine learning, we are dealing with data that we measure, and then you build a statistical model.
Yes.
So one of the interesting questions is, how do you feed in these kind of simulations, which are simulating the impact on a community and spread of disease with measurements that you're actually taking? And that's where so much more research needs to happen in how these things actually need to combine in interesting ways.
Yes, that is very interesting. I mean, the fact that it's not that machine learning doesn't exactly simulate might in fact be an advantage when you have unknowns. Can I ask you then about, I want to ask you about new tools for foresight. I know this is something you've given some thought to, whether there can be new tools for thinking forward, thinking about the future. Can you give me a sense, give the audience a sense of what you think these might be? I realize it's a slightly circular question, because without having the tools, how can you tell what they're going to be? But what do you think good prediction, good foresight requires?
So I think this question of foresight is probably one that we'll talk about much more over the coming months and years in general. And I think foresight, can mean so many things to people. But in fact, there is a whole field of foresight, what are called foresight methodologies. And foresight methodologies ask us a very simple question. How is it that we can think and reason about the actions that we take today can impact, shape, or create the future? And I think we really want to do that exercise, particularly now, because we're going to make many changes to the way we are running society that will impact, shape a new kind of future. So I think for me, there is a role of technology, there is a role of machine learning in building predictions, which are part of that foresight. But ultimately, the real foresight that we need involves more deliberative mechanisms, more conversation, dialogue between all of us. I think some of those key things involve criticism, where we are much more openly critical with each other, maybe perhaps the approaches that you mentioned from Professor Gray, and equally the response of the government to note that it's not just only scientific data that comes into conversations, but there are political and social questions which are coming into contact. And so that role of criticism and entertaining that criticism, I think, is one that becomes so much more important to us. I just mentioned this idea previously that we have a lot of historical reason to be very careful. And I think this kind of hindsight that we have from our historical period and decisions that are made in a sort of very ahistorical way can become a very dangerous way. So I think one important role of foresight is to use the advantage of hindsight that we actually have. And then I think more generally, we need to be more considerate about what happens when we are developing technology, making decisions. We often have a very typical person in mind. The average South African, maybe someone who's living in Johannesburg, not far from the University of Johannesburg, in Auckland Park, or somewhere else. And you usually don't want to think about those people in the design. You want to look at who is at the very edge of your imagination of that technology. So, I do think that machine learning has a role in that play for us to think about ways of connecting data in ways that help us support those decision-making, to help us think about the fact that when we do make changes, behavior changes, and necessarily the data then itself changes, and then how we can create systems of robustness that help us entertain criticism, be a bit more critical, and rely on our own hindsight, and then create the kind of system that deals with a different kind of values. And I think this is one question of foresight, is really to question the kind of values that we have. Do we always care about material values? What other kinds of immaterial values may be at play? For example, principles of Ubuntu. How do they center in the way we are going to design these kind of tools of foresight? So that's, I think, is a more very general, broad view of how I think about the role of foresight. And I think technology has a very important role to play in supporting those new mechanisms of foresight.
Okay, that's very interesting. Okay, let me move on now. I think there's certainly some things we can come back to in the discussion there. Thank you very much. That's very interesting. Let us move on now to Professor Charis Harley. Charis is joining us on the phone, I believe, because there is a problem with her data connection at home.
Naturally.
Yes, naturally. Professor Charis Harley joined the UJ's Faculty of Engineering, the Built Environment recently. She's a computational mathematician and she has worked in industry as a data scientist. So can I start by asking you the question about models and their assumptions and their data? So, you know, it's kind of trite to say the model are only as good as their data and as their assumptions. Do you think that this has been forgotten in the current pandemic? Do you think that models have somehow bootstrapped themselves above the credibility they ought to have and beyond their assumptions in the public eye? Yeah.
I think actually that's a very valid statement to make. At the end, it's definitely a huge mistake to try and theorize before you actually have the data. What often happens is when you have too little data, or you tend to take whatever facts you do have and try and twist them to match what you're trying to theorize about. And I think what's happened is that there seems to have developed two camps of scientists in my mind. Those that use this opportunity very much to publicize themselves or their science. And then those that are still trying to do good science to try and assist us during what is a social crisis at present. It is very much well known that the quality of data surrounding COVID is not that good. It's not reliable. We know the data is being withheld by various agencies. We're aware of the fact that there are time lags in the data that's being released. I mean, just the time lag based upon the tests that are being conducted is one instance. We know as well that in certain cases there's very little data, so making generalizations would be very dangerous. We're also not always aware of the context within which certain data sets are being constructed. So being able to then compare data sets or pull them together into a collaborative model becomes very, very tricky. And it is also true of model assumptions, I think. At the end of the day, when you're using a mathematical model, there are often hidden assumptions that you are employing to be able to model something. And without stating these assumptions very clearly, without being open and honest about the thought framework that you are employing when you are using this model for predictive purposes, you're kind of introducing a piece of the puzzle and you're not providing the whole vision of what that model is representing. The underlying assumptions of a model can very much dictate what it's capable of predicting, what it's capable of analyzing, and also whether it's even compatible with the data that you're using to try and construct the model. So I don't think that there's anyone that is functioning in the field that is unaware of the questions surrounding data quality or the fact that there are always underlying assumptions when you're employing a model. I think that it's for the sake of bootstrapping and for the sake of getting something out very fast, I think it's not always been communicated as effectively as it should have. And I think that certain statements have kind of been left unmentioned.
I mean, something occurred to me about freedom of speech in science. I mean, I criticized the government in the outset, but it's also struck me that at certain points there looks like being a bit of a lockdown or it became quite difficult within certain scientific circles, at least that were visible to me, to express a contrary view. So that there were people in the public health world who were very, very, very strongly in favor of the strongest possible measures against COVID-19 on the basis of models. And now, of course, those questions about the assumptions of the models are being asked. It's obvious that the most influential model from Imperial was just very, very wrong in its predictions. I mean, predicting 1 million people dead by now, as far as I can recall, and we just don't have 1 million people dead globally. So do you think there's an interesting, I mean, do you think there's something to be said about freedom of debate and of discussion even within the scientific context?
I think actually that's a very, very important question, actually quite a tricky question to answer. I think that it does tend to happen that there's often a stronger voice, even in science, and that there's often at times a lone voice that's very easily ignored. I think that what has happened, given the nature of social media as it stands, the loud voice becomes loud very fast. And that is often very, very dangerous, because to my mind, even the research articles that I've seen that have come out with actually very good legitimate research around COVID, it's based upon years and years of prior research. Research takes its time. It doesn't rush. It's systematic. There's a scientific process that's being employed in order to be able to actually say something as accurately and as well-founded as possible, which means that the first voice that often becomes the loudest is not necessarily the expert speaking. In my experience, limited, experts tend to take their time and assess first before they start voicing an opinion. They're usually not the first to start stating what it is that they think. And hence, platforms for healthy debate within science, especially in a context such as this, where there are differing opinions for various reasons, is very, very important. And it is important for those experts, specifically those experts, to be given that platform to support their voice to be heard, specifically if they are experts that have been in the field for a span of time and hence have historical knowledge from which to draw, and hence assist us to be able to make any kind of possible predictions at all. So I think it's a very, very important comment.
Thank you. I want to ask one final question. It's a slight change of tack. I mean, something that's been happening in some places is that there's been attempts by governments to get access to information about people and their movements in particular that's obviously available because of the fact that a lot of people have smartphones. On the other hand, the people that own the operating systems of the most common smartphones, who are Apple and Google, have been quite clearly pushing to keep data private. They've got technical approaches that mean that most data, where possible, is stored on the phone rather than in the cloud and so forth. What's your view on the way you weigh the private and the public interest in this sort of thing? I mean, in what circumstances, if any, is it okay for somebody's data that they've been, giving either without their knowing or on the basis it's private to be used for the public interest, like preventing the spread of a pandemic?
That's a question that could lead to many days' debate.
Yeah.
Look, I must be honest, I think the debate surrounding data ethics, privacy concerns, it's been a long time coming. As people have started realizing the importance of data, the impact that data can have, and what it is that you can do with it, people have become more and more concerned. What used to be easily accessible data is now got way more rules and regulations. And I mean, that makes sense to me. In terms of weighing up, in this case, I suppose, private interest in privacy and public health concerns, the question for me will often come down to how enormous is the threat that we are considering when it comes to violating our privacy rights. And I think that is one of the questions that we have not been able to answer, is to what extent is COVID more of a threat than previous pandemics have been? And is it such an enormous threat to our public health that we need to violate our privacy rights? At the end of the day, I would say that you need buy-in. There's a balance to be struck. Past experience has indicated that if you try and enforce certain kinds of regulations, if you try and force breaking people's rights, it tends to lead down a dangerous road. It leads to a breakdown in trust between government and the public. I think South Korea, for me, is an interesting case in this. During the MERS outbreak in 2015, the government refused to announce which hospitals were witnessing outbreaks, for instance. And the citizens slammed them for the lack of transparency. They were extremely unhappy with this. This time around, however, South Korea strove to find a balance. So they actually learned from what happened during the MERS outbreak. And they had, with citizen buy-in, they had extensive social distancing, which often happened naturally without the government needing to put it in place. And they scaled up in terms of preventative measures, precautionary measures, specifically around tracing. So information is being released to the public indicating where people that were positive COVID instances have been moving, so that they could understand where there was possible instances of spread. But this was done with public buy-in, and it was as a consequence of a country that had experienced another pandemic and wanted to learn from it. So you can imagine in the country, there are many people that think that South Korea struck a very good balance in guarding privacy and maintaining public health. And then there are others that think differently. And I think every society will probably take a slightly different stance. I think the nature of your society, its views on freedom, its views on privacy concerns will very much dictate that. So it's one of those questions that very much at the forefront of everyone's minds, and it needs to be debated extensively.
Thank you. Well, thank you very much. I think we shall move on now to Professor Olaf Dammann, who is the Vice Chair of Public Health at Tufts University in Boston, and Professor of Perinatal Neuroepidemiology at Hanover Medical School in Germany, as well as Adjunct Professor in the Department of Neuromedicine and Movement Science at the University of Science and Technology in Trondheim in Norway. Thank you for joining us from Boston, where it is currently, I believe, 7:30 in the morning. Is that correct? Yes.
That's true.
Good. I'm glad we gave you a good reason to be up and at your computer. Can I start by asking about this same question that's been in the background of a lot of what we've been talking about? Do you think data science did help us make predictions in the pandemic? I mean, I've sort of suggested it didn't, and Shakir sort of suggested that was probably a responsible thing. And what's your sense of why not, if that's the case?
First of all, thanks for having me, Alex. It's great to be here, and it was a sheer delight to listen to Shakir and Charis's take on things, and yours, of course. The main issue from my perspective as an epidemiologist is the sheer complexity of things. This is a pandemic, and by definition, pandemics are global, and so any variable, any factor that is play locally in countries or in parts of countries or on continents, not necessarily play a role globally as well. And so we have a very intricate system of variables that interact, and this is extremely hard to model if you are not trying to model exactly that. All the models we have are comparatively simplistic, and they are also interest driven. So what I'm saying is what the modeler puts into the modeling plays a huge role in the quality and the predictive quality of these models. So in essence, what I'm saying is all models are wrong, as George Box suggested, but some are helpful. And the helpfulness of the model is limited because most of the models are sort of global, but our interests are local and have to be local, and decision making has to be local, and that is very, very difficult when you're using global models with only a few variables that are affected by the interests of modelers. And therefore they don't necessarily give us what we want. Above and beyond that, all what we want is also different locally, and that's a big problem as well.
Yeah, perhaps you can tell us a little bit about the relationship between models and epidemiology. I mean, I've thought for a long time that epidemiology, deserves to be better known. It's the kind of the biggest science you never heard of for many people. And now it is rather well known, but perhaps only a rather small part of it has come to represent the whole. I mean, what's the relationship between modeling and, firstly, infectious disease epidemiology, and then secondly, between infectious disease epidemiology and the discipline as a whole?
Well, good question. The discipline as a whole really comes from infectious disease epidemiology. The name epidemiology itself, the science around the people, and the term epidemic being used for infectious disease outbreaks for hundreds of years is a clear sign of that. The modern epidemiology that we have in our textbooks is more a science of the design of studies to figure out disease occurrence patterns and risk factors for diseases, and also the effectiveness of interventions. So epidemiology, as we do it today, is way broader than infectious disease epidemiology, which is basically the application of epidemiological methods to the study of infectious disease occurrence and outbreaks and epidemics and such. As such, epidemiology, in my thinking, is basically health data science.
Okay.
We are using data to, we are gathering data in order to understand what's going on, and then we're using these data in order to predict. And this is something that both Shakir and Charis have already touched on. But all that we predict in epidemiology is based on what we have experienced and studied before, and that determines the quality of our predictions. It is really hard to model something that we have never encountered before, and this kind of pandemic, as the COVID pandemic, is something that is really novel to most epidemiologists. Because we haven't had such outbreak with this magnitude for a long time. And at that time, when we had it, for example, in 1918, we didn't have the data science tools we do have now. So this is all fresh and new, and we're learning. And I very much liked Charis's comment on that the good scientists keep their mouth shut for a long time before they say anything. And instead of crying wolf, they think 3 times about what they want to say. And this is probably what should have been done, but on the other hand, the people, and rightly so, want information. So what do you give them? Imperfect information, fast information, good information, but only after such time. It's difficult.
And what's your sense about how to make decisions in that situation? I mean, you know, obviously sometimes one has to make a decision even if one doesn't have a perfect amount of knowledge yet. And I think, you know, one of the senses that people have, and certainly I've had this thought, is that there was actually overconfidence on the part of a small group who hadn't considered everything. You know, and most obviously what they modeled at, say, Imperial College London was not the effect of any particular intervention. They modeled the effect of the result of that intervention. They modeled the result, you know, the results of reduced social distancing without considering any particular way of getting there. It's a bit like imagining that somebody just got thinner without working out how they did it and considering the effects of that. What's your sense then of what should be done in a situation where, firstly, as you say, cautious people are keeping their mouths shut? Secondly, incautious people step forward to fill the void.
Yes, and we do see this in the United States, where I live, every minute. This is almost like the media wars. It is who's shouting the loudest is heard the most. I think what we need is better inner science communication, if you wish. This is very much a data quality problem, as Shakir stressed, as it is a communication problem. If we don't have communication channels that allow us to make these decisions jointly, by including as many stakeholders as possible, we will not be successful. In many areas of the world, the needs of people are totally different, and so the decision making basically needs to be distributed. And at the same time, since this is such a new phenomenon, everybody is looking everywhere. What does my neighbor do? What do they do in the US? What do they do in Europe? And they are using the decision making across the pond for their own decision making, which may be completely wrong and may go in a very different and very wrong direction. My personal opinion here is that the simpler the model, the better, because making the models more complicated and making them more complex and including more variables doesn't make models better necessarily. It makes them more complex. But that doesn't mean that the prediction will be better. Sometimes very simple predictions are way better than complex predictions. And and we need people who understand this, to talk to people who make the decisions in public health. It is not epidemiologists that make the decisions. The epidemiologists play with the data, and then they share them or not. And the people in the public health departments or in government make the decisions what to do with these data. And we need to break through that disconnect there. We need to make these people better understand each other, and see that sometimes a simple model can be better in terms of prediction than a complicated model that includes everything that you really want to include, but you have no way of knowing whether it's a great or better model than the simple model until the future happens and until you can compare.
It's interesting you said about simple models. Winston Churchill is supposed to have once been shown around a weather station, and they proudly said they were now getting the weather right 40% of the time. And so he said, why don't you just predict the opposite? And I mean, somebody else actually this week quoted Winston Churchill, a media person, and caused controversy by doing so. So there you go. Churchill has been mentioned twice this week in South Africa. Let's throw this open now. I want to ask all of the panel about this point about models leaving important things out. And of course, that could be because of the interest of the modelers, and it could be because of what we do and don't have data on. You can't represent, for example, a social custom. You can't easily represent the fact that in Malawi, all the women in certain regions go and sell tomatoes in the market. Not all of them, but a large number of women do that, simply by saying a certain percentage reduction of social contact. And of course, there's the interests of the modelers. So all the panel, I mean, do you think that's affected the way that projections have been made? Do you think it's actually projected the accuracy, affected the accuracy of those projections, notably given, I mean, we don't know what's going to happen, but given that things haven't taken off in the way in South Africa and in Africa as a whole that one might have expected?
You say something around what you were referring to
Okay.
with regard to the modeling, but I think that I'm probably actually going to lean more towards what I think Olaf and Shakir have said to date, which is more around the data aspect of it, which is the fact that when you're leaving out a certain aspect of a model in favor of a simpler model, you're basically leaving out a piece of data, simplistically. And the question is, why? Do you have a reason for doing so? And can you anticipate what the consequence of that would be? Now, for me, I actually agree with Olaf. I think simpler models are often better because you can more easily understand and interpret your results. The moment that you start trying to take into account too many complexities within a model, I think it's much more likely that you will misinterpret what it is that you're getting out of your model. So for me, currently, from where we're standing in terms of the modeling, I would prefer that we in fact focus on data gathering, that we focus on setting up appropriate platforms for good data gathering, taking into account privacy concerns, ethical concerns, engaging with that, and also setting up appropriate communication platforms, so that once good data quality has been confirmed, once the actual data investigation happens, exactly like Olaf was saying, the correct stakeholders are there. Communication is happening effectively with the correct individuals. So for me, in many ways, I would actually, rather than focusing on the use of models that can may be useful, I would say we now do have new tools like Shakir was speaking of. We do know that there are new ways in which we can model through data. Let's rather focus on creating the platforms that allow us to do that now, when we can see the use that it will have in the future.
We've got a question in here that's almost, Shakir, did you want to respond to that?
I wanted to maybe just bring a slightly different element of this conversation in, because I think it's,
Sure.
It's touching on something very fundamental in some sense, that there's a tension that we all have across all of the computational and data sciences of, on one hand, this idea of what is knowledge. On one hand, you have people who say, well, we need to just collect more and more data. And this is a view of knowledge that the more data you collect, the more complete that knowledge will be, and that's how we can make decisions. On the other hand, you have another camp of people who say, well, knowledge will always be incomplete in this way. We'll never be able to get this perfect and complete set of data. And so there's this question that we are talking about is actually touching on this far larger debate, which is actually going on across all our fields, of a very philosophical question of what is constituting knowledge. So I just wanted to put that out there as a thought, and then just also to bring up on the point that Charis just mentioned around ability of interpretation versus predictive ability versus complexity of the model. And it's unclear that these three things are aligned depending on what the task of decision-making actually is. So I agree on we should focus on the data gathering process, but I also think we need to focus on what the decision-making task is. A model that's good for decision-making does not necessarily need to be, or does not necessarily need to be something that interpretable in a very fine-grained way. There are many variations of that. And I think one mechanism that we always have available is just to create many different models across many different teams. And my model may be good in one area, your model may be good in another area. When we combine them and average them in different ways, there's a principle that we actually use of model averaging and model combination across all our sciences. I think that's one thing that we didn't do enough of in this current phase that maybe we should do more of.
I wonder if I can ask that about this question about whether, when and whether one has enough data. I mean, in a sense, one of the point of science is to be able to say things you don't have enough data to say, because if you found out all the facts there are, then you wouldn't need any scientific theories at all. You'd have a big book that said everything that you might ever want. Newton's theories use tiny amounts of data to come up with huge universal laws. So in a sense, we always want to be able to go beyond our data in science. I mean, I wonder if maybe there's a distinction to be made between first and second order sort of thinking. So one is, well, on the sort of first order, what can I infer from my data? And in a particular study or a particular model, you might get a certain answer. But the second one is, well, stepping back, how confident am I? And perhaps in the second, it was the second that failed. In this, that there wasn't enough humility, if you like. There wasn't enough sort of sense of, well, this is what I've been working on night and day, and I'm invested in it. But if I'm honest, in 5 years' time, it's not going to be what we're using. Do you think that was a factor?
Just to say, I think there is a very important role for confidence assessment in general. But in general, this is actually a very difficult question to ask. How do we build confidence? How we communicate confidence? Confidence is not necessarily the same as risk, because risk involves also the decision-making task and thinking about how that confidence impacts the decision-making that happens. So I think, as everyone else said, and also the point that you said, it's not this idea that we have of that, you should be able to connect enough data. That doesn't apply when we are operating in very complex social scenarios. And public health and healthcare is always a very complex social scenario. So we will never have this complete set of data. So I think we need other ways of collecting knowledge, of bringing the public in, as Charis is mentioning, much more in the early phase, how it is they are a source of knowledge and a source of, way of testing things, a sort of understanding what is working, what isn't working, and also sort of assessing where those kind of different tasks and decision-making factors come in. But, this confidence is sort of the field of study that I work in, and so, that will always be for me the number one kind of question of how we use confidence to inform decision-making.
I've got a question I've had here from somebody saying, this is for Olaf, it relates to that. Do you think, if you look at the differences between the dynamics and population of demographics between the North and the South, the global North and the global South, do you think that lockdowns have been effective in the global South? I don't know to what extent you've really been following what's been going on here, but given the differences in context, do you think they have been effective?
From what I know is that it hasn't been effective, and it is also as you and Smart said and published multiple times now. It may really not be a very good idea to lock down a country like South Africa for multiple reasons that I don't want to rehash here. But for me as an epidemiologist and modeler, there's always differences between North and South and East and West. There's differences between individual countries. And the current challenge with COVID is that our models are based on population level data, and what actually is going on is happening at the interpersonal data, at the interpersonal level, where one person is infecting one or multiple others. So all these models that just result in a curve being flatter or not are very different from those models that are being done with agent-based modeling, for example, where you actually simulate people intermingling and infecting each other, and the modeler sees what happens there. I have not yet seen any good meta model, so to speak, that brings together these two aspects. But that may be just my ignorance. I can just for the person who asked the question, I cannot even say that that lockdowns have been really successful in the North. There are countries that didn't do much of a lockdown. Sweden, for example, and they look definitely better than the US right now. And with all these lockdowns, you're almost always behind the fact. You're always trying to prevent things from getting worse, but they are already bad, and that's one difficulty. Feeding back into the models the experience that we have here and now, the data that we have here and now, and then try to make the models better by doing that moving forward.
What's your sense of the difference between, say, Sweden and the USA, since you mentioned those two? I mean, we had Johan Giesecke on a couple of weeks ago, and we were asking him about Sweden, and he has a clear view. But, it looks like the USA hasn't responded. Of course, they don't have that many deaths per million because they're a large country. But I mean, why is it that in some places you see what is rather a dramatic set of circumstances, and in others much less so? Given apparently similar approaches. I mean, the Swedish approach for a different set of reasons was a moderate one, and the American one for a completely different set of reasons was also a moderate one, and yet they seem to have had different consequences. Do you have a sense of why that might be?
I do, but this is more based on prejudice than on data. I think that in the United States, for example, people always pretend that we are decentralized and all the power is with the states and so forth. But right now, the power is with basically one Twitter account, and this person can tweet whatever he wants and can use whatever medication he wants, and lots of people believe it. And there's there's the consequence to this. When you go out, despite all the lockdowns that states wanted to do, on the coast, the kids were on the beaches partying, spreading the news, and that is so counterintuitive, but it's a clear sign of that people don't care to the extent in some areas of the world as much as they do in others. And that we see the consequences. We just hit 100,000 deaths here in the US, and some people do as if they're a surprise.
I've got two questions that have come in through the Q&A function here. One of them says, from Stefano Canali, thanks for this great discussion. What do you think of the integration between biomedical and socioeconomic predictions on the pandemic? I'm thinking in particular at current discussions on the socioeconomic effects of measures such as lockdown. These predictions are usually based on very different models and data from epidemiological and biological models, and especially the levels of uncertainty and quality of data seem to be very different. Still, to me, they seem to be discussed as the same types of modeling and predictions that can be easily integrated. So this is for any of you, I guess. What do you think of that? This is really, I suppose the question is about the sort of incommensurability of different ways of approaching different kinds of information when you're trying to make predictions.
I think this question is hitting the bull's eye. These are two kinds of worldviews: the socioeconomic and the biomedical worldview, and only very infrequently, even in risk factor studies in epidemiology, we really let the two intertwine, and we discuss questions like how can socioeconomic variables be interpreted biomedically and so forth. This is exactly what I have been asking for previously in this discussion: the integration of models and of modeling techniques. And I have to defer to those who actually can do this technically. I cannot. I can just think about those more or less intelligently and give my opinion. But that is just what is needed. The downside is that doing this makes the resulting supermodel really, really complex. And what you have to think about is, when you're modeling, you always have to think about all the interactions between all the variables. And what I mean is all the variables in the model. And this is really very difficult to do with especially something biomedical and something socioeconomical. You can do it in some ways, but the assumptions become really, really wobbly. How does socioeconomic status affect a certain protein level in your blood, and so forth? This is our general knowledge. Going back to what Shakir said so wisely. Well, how do we know what we know, and how do we know what we don't know? How to integrate these models is really non-trivial. I'm not saying it's a pipe dream. I'm saying it's already been done, but the question is, could it be done in the current context? I don't know of any such model that has tried to do that. I very much like that comment and that request.
I've got one more question here, and another one on my other route, but let's take this one. This is from Nimi Hoffman saying, I appreciate Shakir's comments on public participation. I want to ask then, what is the role of lay public deliberation in the research policy nexus? For example, school feeding schemes in South Africa were shut down as part of the lockdown, but school feeding is a critical component of children's nutrition. Why were children and parents not consulted on how to weight the risks and dangers of ending school feeding versus flattening the curve? And how could we avoid this happening again? So let's take this for Shakir, but I think Charis and Olaf, you can also chime in, I'm sure.
Thanks, Nim, for the great question. The particular case, I think, for school feeding is one that I won't comment on because I don't know much about that area. But in general, I think we can do much more to create systems of public participation. Because I think, going back to all these questions of knowledge, there's a really significant body of knowledge that lives within the public. When we have very complex situations like the one that's currently going on, you cannot measure everything. You cannot test everyone. You cannot get data from everyone. But the public are the people who are touching it. They are seeing these things. So there are many mechanisms, I think, that we can do more of going forward. Now that we sort of have this experience, I think there are ways of creating design of public deliberation when we are creating new kinds of models. These are called participatory action research. And there's a whole growing body of the way that we can do these kinds of research for different kinds of interventions. For these kind of questions around sort of school feeding schemes, we have many kinds of other models. One of them, for example, are called citizens' juries that are used in many parts of the world. And even parts of South Africa have used those in the past, where you actually try to assess in a more deliberative manner the role that the public's understanding is, their concerns, particularly different kinds of socioeconomic areas. So I think we should definitely do much more of this, and the lay participation, just because it's not complex, doesn't mean that it cannot be communicated to the public. And again, the public has a very powerful mechanism of knowledge. They typically see things that are happening at the individual level that Olaf was mentioning. There's a need for individualized level data, personalized level, and you can use the public in interesting ways to do that. We see this in more general scientific areas, what is called citizen science or crowdsourcing. That can be a different mechanism. Although I will just, at the same time, in the same breath, also say that right now we are having to do things under many different and difficult circumstances, needing to do things very quickly, that the mechanism and role for these kind of deliberations aren't in place. We needed to have them already to make these kind of effects. So I understand the challenge at the same time of making very quick decisions that need to be done. Just wanted to recognize that ongoing challenge at the same time.
Thank you. Charis, do you want to comment on that one?
Yes, I actually think that it's a very, very important question that was raised, mainly because I think it starts to speak to how it is that we need to start viewing communication moving forward. I think for me, one of the things that this pandemic actually brought to light was the fact that possibly in terms of communication platforms, we maybe do not have the most effective communication platforms, not just amongst scientists, but probably between scientists and government, and in this case, between lay people and other forums. I think we see the explosion in social media and we think, oh, well, we've got communication down pat, and I don't think that that's true. When we were doing an assessment of basically what was the feeling towards lockdown, for instance, depending on the social media platform we looked at, there was a very clear leaning towards either being pro or against lockdown. So whether you were looking at Facebook versus Twitter versus another platform, which shows you that different people are drawn to different platforms. And we actually, preferably under such circumstances, need some means of communication that allows us to get a sense of what the population is thinking. So specifically people that would be influenced by, for instance, nutritional programs being shut down. We need their opinion, not everybody on Twitter. So being able to get at the correct individuals who's basically setting up appropriate communication platforms so we can get the opinions of the relevant parties. I think that we need to look into this. We need to start assessing, are we really communicating as effectively with each other as we actually can, given the technologies available to us?
Great. Well, the new normal is to finish more or less on time, as we've been remarking on previous weeks. So this is not normally how academic events work, but that's what we're going to do. It's also, in fact, as I've been thinking, a remarkable feature of the current situation that we're able to access, especially in the Global South, people from just all over the world for a regular weekly event. And I very much hope that does continue as people unlock. It's a remarkable thing. So I'd like to thank all of the panelists. That was very, very, I certainly found that very, very thought-provoking and interesting. And next week we will be talking about social protection and social issues relating to COVID-19. We'll announce that in due course. Thank you so much, and we hope to see you again at the same time next week.
The University of Johannesburg, the future reimagined.